Imagine a world where the cure for anxiety, irritability, or even just a general sense of rebellion wasn't a therapy session or a yoga class, but a very specific, very physical procedure performed by a distinguished medical doctor. We tend to think of the Victorian era as the pinnacle of prudishness, a time of stiff collars, unmentionable ankles, and repressed desires. Yet, behind the closed doors of respectable medical clinics, something was happening that seems utterly contradictory to that buttoned-up image. For decades, physicians engaged in a practice that today would be considered deeply intimate, yet at the time, it was viewed with the same clinical detachment as setting a broken bone or lancing a boil. It was the standard treatment for the most common, yet mysterious, diagnosis of the age, female hysteria. But why did the medical establishment believe that inducing physical release was the only way to cure a woman's mental distress? And how did this strange medical necessity accidentally spark the invention of one of the most enduring technologies in history? The story is far stranger, and more complex, than you might think. To understand the cure, we first have to understand the disease. In the 19th century, hysteria was the catch-all diagnosis for almost any female ailment that doctors couldn't explain. If a woman was feeling faint, hysteria. Was she irritable with her husband? Hysteria. Did she have a healthy sexual appetite? Hysteria. Did she have no sexual appetite? Also hysteria. The symptoms list was comically long and contradictory. It included nervousness, fluid retention, heaviness in the abdomen, muscle spasms, shortness of breath, and a tendency to cause trouble. Essentially, if a woman wasn't fitting perfectly into the quiet, submissive angel in the house archetype that Victorian society demanded, she was likely labeled hysterical. It became a convenient wastebasket diagnosis. Physicians estimated that a staggering 75% of women suffered from it at some point. Because the diagnosis was so vague, the patient pool was enormous, creating a massive demand for a solution to calm these nervous women down. The wandering womb, ancient roots of a Victorian obsession. While the Victorians industrialized the treatment, they didn't invent the idea. The concept of hysteria dates back to ancient Egypt and Greece. The word itself comes from the Greek word hystera, meaning uterus. Ancient physicians, including Hippocrates, actually believed that the uterus was a distinct, living animal inside a woman's body. They thought that if this animal wasn't satisfied specifically through pregnancy, it would become bored and start wandering around the body, bumping into other organs and causing illness. This wandering womb theory persisted for centuries. By the time we reached the Victorian era, medical science had advanced enough to know the uterus stayed put, but the connection between female reproductive organs and mental stability remained unshakable in the medical mind. The prevailing belief was that the nervous system was intrinsically tied to the reproductive system. Therefore, the congestion of fluids in the pelvic region was causing the brain to malfunction. The logical medical conclusion? The congestion had to be relieved. Here lies the great paradox of the Victorian era. Society insisted that good women had no sexual desire whatsoever, that they only endured intimacy for the sake of procreation. Yet, doctors recognized that their patients felt better after a specific physical release. To reconcile these two conflicting ideas, they stripped the act of any sexual connotation. Doctors didn't call it an orgasm, that would imply sexual pleasure, which reputable women weren't supposed to have. Instead, they called it a hysterical paroxysm. It was viewed purely as a medical event, a nervous seizure that released built-up tension in the system. When a doctor performed pelvic massage to induce this paroxysm, it wasn't considered a sexual act. It was a medical procedure, no different than clearing a blocked throat. This linguistic gymnastics allowed doctors to perform genital stimulation on patients without violating the strict moral codes of the time. The goal was simple: bring the patient to a state of paroxysm so she would feel relaxed, relieved of her symptoms, and docile again. As the diagnosis of hysteria skyrocketed, so did the workload for physicians. A typical treatment session for pelvic massage could take anywhere from 10 minutes to over an hour to achieve the desired paroxysm. For a popular doctor with a waiting room full of wealthy Victorian women, this posed a significant physical problem. Manual stimulation was tedious, labor-intensive work. Doctors began complaining in medical journals about the fatigue and cramping in their hands and wrists. It was difficult to maintain the necessary rhythmic motion for long periods, and as the day wore on, the doctors' effectiveness waned. They were literally risking repetitive strain injuries to treat the epidemic of hysteria. They needed a better, faster, and more efficient way to treat their patients, a way that didn't rely solely on the endurance of the physician's wrist. The Industrial Revolution had mechanized textiles and transport. It was only a matter of time before it mechanized the hysterical paroxysm. Steam, coal, and muscle, the first mechanical solutions. Before the sleek devices we know today, the solutions were monstrously industrial. In the mid to late 19th century, inventors began creating massive machines designed to shake, vibrate, and massage the human body. One of the earliest examples was the manipulator, a steam-powered table that looked more like a torture device than a medical tool. These early contraptions were not portable. They were furniture-sized beasts found in spa clinics and hydropathy centers. There were horse-riding simulators and vibrating chairs powered by steam engines in the basement. The famous Chattanooga vibrator was a wind-up mechanical device that was essentially a vibrating stick, but it was aggressive and loud. While these machines could induce vibration, they were clumsy and often targeted the whole body rather than the specific pelvic region required for the hysteria cure. Doctors needed something precise, something they could hold, but that provided the power they lacked. The breakthrough came in the early 1880s, thanks to a British physician named Joseph Mortimer Granville. Interestingly, Granville didn't invent his device to cure hysteria, he invented it to treat muscle aches and spinal pain. He patented an electromechanical vibrator called Granville's hammer. It was a handheld device that used a wet cell battery, a huge, heavy brick of a thing that had to be dragged around on a cart connected to a vibrating wand. However, other physicians quickly realized that Granville's hammer was the perfect solution to the hysteria workload problem. It was consistent, it didn't get tired, and it could induce the paroxysm in a fraction of the time it took to do so manually, often in under 5 minutes. This was a revolution. It allowed doctors to see more patients in a day, increasing their revenue while saving their wrists. The vibrator quickly became a standard piece of medical equipment, found in the offices of gynecologists and general practitioners alongside the stethoscope. By the turn of the 20th century, electricity was entering the home, and the vibrator followed. Manufacturers realized that while selling to doctors was profitable, selling directly to consumers was a goldmine. The narrative shifted from a complex medical procedure requiring a doctor to a home remedy for health and vigor. Advertisements from the early 1900s appearing in publications like the Sears Roebuck catalog and respectable women's magazines marketed vibrators as home appliances. They were sold alongside sewing machines, fans, and toasters. The marketing was brilliant in its coded language. They promised to cure female weakness, nervous prostration, and to restore the spark of life. They even had attachments for churning butter or mixing cake batter, providing a perfect plausible deniability. A woman could leave her vibrator on the vanity, and it was viewed as a health aid or a beauty tool for removing wrinkles, not a sexual device. It was hiding in plain sight, a medical secret sitting on the nightstand. So, why did the vibrator disappear from the Sears catalog and go underground? The answer lies largely with Sigmund Freud and the evolution of psychiatry. In the early 20th century, the medical understanding of female sexuality began to shift radically. Freud and his contemporaries argued that the hysterical symptoms were indeed sexual in nature, specifically, the result of repressed libido. Once the medical community acknowledged that women did have sexual desire and that the paroxysm was actually an orgasm, the innocent medical treatment defense fell apart. Doctors could no longer claim they were just relieving nervous tension, they were providing sexual gratification, which was socially unacceptable for a doctor to do. Simultaneously, the newly emerging pornography industry began featuring vibrators, stripping them of their medical camouflage. The device went from a respectable health appliance to a scandalous taboo almost overnight. By the 1920s and 30s, the vibrator had vanished from mainstream advertising, relegated to adult shops and the back pages of seedier magazines. Looking back, the era of treating hysteria with pelvic massage serves as a fascinating lens into how society views women's bodies and mental health. It highlights a time when male-dominated medicine was so determined to ignore female sexuality that they had to invent a fake disease and a non-sexual medical orgasm to deal with it. It also raises questions about how we treat women's pain and psychology today. The diagnosis of hysteria has been removed from the DSM in 1980, but the tendency to dismiss women's physical symptoms as psychosomatic or stress-related persists in modern healthcare. The vibrator, meanwhile, has completed a full circle from medical tool to taboo secret, and finally to a symbol of sexual empowerment and wellness. But perhaps the most enduring legacy is the realization of just how much culture dictates science. The physical reality of the human body didn't change between 1880 and 1920, but the story we told about it did. What was once a clinical paroxysm became a sexual orgasm simply because society was finally ready to admit that women were sexual beings. The story of Victorian hysteria is a wild ride through medical history, proving that sometimes the truth really is stranger and more buzzing than fiction. If you enjoyed this deep dive into the secrets of Victorian medicine, make sure to hit that like button, it really helps the channel out. Let me know in the comments, what other bizarre historical medical practices should we uncover next? And don't forget to subscribe and ring the bell so you never miss a dose of history. Thanks for watching, and I'll see you in the next one.